Okay, we're going to start our exam on entry of the patient. He came in, had general inspection. His vital signs were taken and blood pressures in both arms, and they were normal. His height and weight was obtained, and his BMI is 130. So we're going to go ahead and start the head-to-toe examination. I would like you to use your glasses and stand out right here and read that vision chart, and that checks for distance vision. And I'd like you to read the line over there by the big number 8. Read that there.
DEFT0TEC.
Okay, thank you. And then while you're at the reading, I would like you to read this paragraph here, and this is going to actually test your near vision.
Okay, such an arrangement can show any 3 months desired. The most common use would show the past, current, and following months.
Okay, thank you. All right. What I would like to do, if it's okay, I'll take your glasses off. I'm just going to basically do a general inspection of your head, okay, and looking to make sure everything looks even on both sides. I'm going to be doing some palpating on top of your head. I'm going to be looking for any lumps or bumps or anything different. Any pain or anything in your head? No? Okay. I'm going to go ahead and palpate your forehead and your sinuses. Any of that hurt? No? Here? Alright. Go ahead and open your jaw and check that bone there. Okay. It's a joint back there. And check down here. Does any of that hurt? No? Okay. I'm going to go ahead and just kind of palpate up across your sinuses. Okay. Alright. Okay, what I'd like you to do is I'd like you to clench your teeth, okay? I'd like you to smile real big, okay? I want you to squint your eyes, okay? And then stick your tongue out way out at me, okay? And then go ahead and punch your cheeks. Okay, good. Alright. So then I'm going to look at your eyes, and I'm looking at your eyebrows and your eyelashes, and they look equal and the same. Go ahead and shut your eyes. I'm going to look at your eyelids, okay? I'm going to palpate these little glands here, okay? Okay? Okay. Alright, I'm going to go ahead and pull down on your eyes and look at the whites of your eyes. Okay? It's a little red, and your conjunctiva is a little red and watery as well. Alright. And check your nose here, your bridge, your nose. And that's all. You never had a broken nose. Okay? Alright. Alright, so now I'm going to go ahead and your hearing. Okay? Check your ears. And check and see if you have any nodules or they both look the same, and they do. No tenderness back there or anything. Okay. Alright, I'm going to test your hearing. I'm going to, this is a tuning fork, okay, so I'm going to hit the tuning fork on my hand. I'm going to set this on top of your head. And what I would like you to tell me is if you hear the vibration on both sides equally, if you only hear it on one side, or one side more than the other. Okay, and then we're going to test like behind your ear. You let me know when that sound goes away. And then for conduction, I'll hold it outside of your ear and let me know when the sound goes away. Okay? Okay. You hear it? You don't hear it? I'll try it again. You hear it? Okay, equally on both sides or more than one and both? Okay. Put this on the mastoid bone. Let me know when you don't hear that anymore. Let me know when you don't hear this anymore. Okay. Let me know when you don't hear this on this bone over here. Okay, and then you don't hear it anymore from there. All right. What I'd like you to do is go ahead and close your eyes and let me know if you feel any sensations, okay? Okay. All right, I'm gonna check inside and look inside your ear. Oh, not that one. And that one. Okay. I'm looking at your membrane and it's nice and fully gray. All the landmarks, they're all there. No redness. Okay, this here. Same thing, looking at your membrane. It's nice pearly gray and all landmarks, and no redness or bulging. No tenderness in your ears. You haven't had any tenderness in your ears? Okay. I'm gonna look in your nose while I'm here. And I'm looking at your nose and looking for any polyps or any drainage or anything, any deviations. There's none there. Want to look in your mouth. You can go ahead and open your mouth wide for me. Looking back there, looking at your teeth. Okay, looking here. Any white patches? Any sores? You go ahead and stick your tongue out. Point it that way for me. Okay. And point it that way and lift it way up for me. Up, up. Like that. Okay. Okay. Go ahead and stick your tongue way out at me. Okay, sorry. All right. Okay, so I'm going to go ahead and look at your eyes again. I'm going to basically do a few eye tests here, okay? What I would like you to do first of all is just follow my finger with your eyes, not your head, okay? Okay, so here's my finger here, and just follow with your eyes, okay? We're just looking at your ocular muscles here and doing that. Okay, good. All right. One more time here. And good. All right. What I would like you to do is take this and then cover your eye, and I'll cover mine. And what I need you to do is when you see my hand coming in, so you see your peripheral vision is what we're going to be checking, okay? Here, and just let me know when you see.
You mean when I see?
When you see my hand, these are my fingers, okay?
No.
Okay, and the other eye?
No.
Okay. Now I'd like you to go ahead and cover this eye again. And what I just want to do is I want to just kind of compare your eye, how it reacts when you take the cover off. Okay, take it off. Okay, good. Cover the other eye. Okay, take it off. Okay, good. All right. Now, what I want to do is go ahead and turn the light down. I will turn this light on. And I'm going to ask you to look at the star on the wall over there. I'm just going to check your reflexes of your pupils, okay? And okay, I'm going to check your other one, see how it responds. Okay, and again. All right, and again. Good. I'm going to go ahead and use this here and look in the inner structures of your eye as well. Okay. So, right here. The red reflex. Looking at the disc. The vessels. Let's get looking at the disc, get the vessels and structure inside. Okay. Alright. Okay, what I want to do now then is basically look at your neck. Okay, again, I just want to look and inspect. Alright. And look first, make sure everything's equal. Okay, I'm going to palpate your lymph nodes. And make sure that in the clavicle area here, try this a little bit. Okay, and here. Nothing? Okay. Alright, I'm just going to palpate and listen or feel for your carotid pulse. Okay, on the other side. And go ahead and just swallow for me. And swallow again. Just checking your thyroid. Okay. I'm going to listen to your carotid pulses and your thyroid, okay? Okay. Alright, I'm going to come around the back here. I'm going to ask if you can maybe turn that one a little bit, I'm a little short. Okay, I'm just basically going to inspect your back and your shoulders here. Okay, and look for any abnormalities or any lumps or bumps or any uneven areas. I'm going to go ahead and palpate here. Again, for any bumps or sores. Your scapula here. Sorry, you're ticklish. Alright, I'm going to palpate your spine, okay, for any nodules or any tenderness, any bumps that shouldn't be there. Okay, what I want you to do is say the words 99 for me and keep repeating them, okay? Go ahead.
99, 99, 99, 99, 99, 99.
Okay. I'd like you to go ahead and take some nice deep breaths for me. In and out. Again. Okay. I'm going to go ahead and percuss back here. Okay. Go ahead and take a deep breath for me. Okay. Go ahead and take a deep breath and hold it. Alright. Go ahead and percuss again. Just breathe normal. Okay. Go ahead and take a deep breath and hold it. Okay, so listen. Right here. And take some nice deep breaths. Okay, all right. Go ahead and turn that around forward. Okay. I just want to look at your chest here as well. And again, I'm just kind of looking, make sure I don't have any lumps or masses or anything uneven. I'm going to go ahead and percuss or palpate here. And basically I'm just feeling for any crepitus or any abnormal, anything, any painful, nothing? Okay. Alright. I'm going to go ahead and do some percussion here. Just kind of want to look and see your chest be set up nice and straight. And just kind of want to move forward here. Okay. Just going to listen here, your lungs here. Just take some nice deep breaths. Okay, so listen to your heart, it's very normal. I'd like you to say the words 99, 99 again. Okay, good. Okay, so go ahead and push up on my shoulder. Good. Okay, I'm going to have you go ahead and lay back here. Check out your tummy. There you go. Alright. So I'm just going to have you pull your legs up good, relax your stomach. And I'm just going to inspect your abdomen, looking for any abnormalities or any fluid in your abdomen or any pulsations or anything. And there's not. So we're just going to basically inspect. I want to put a little light on it. Because sometimes if there's a little lump or something, when you have it lit, it shows up a little bit easier. And I don't see anything. Okay. What I'm going to do is I'm going to listen to your tummy, okay, to your bowel sounds. I'm just gonna, go ahead and listen for like your arteries, okay? Listen to like your renal arteries. Iliac arteries. And the next arteries that I'll be listening to is the femoral ones. We're gonna defer those, so we're gonna have to, take your pants down, okay? Okay, I'm just gonna do some light palpation, okay? So I'm just gonna, let me know if you have any tender areas. No? Okay. We're gonna do a little bit deeper palpation here, okay? Just try and relax. No? Okay. And here. No. Okay. Just breathe in here. Please. Here, your kidney. Okay, let's do a little bit of, we're gonna measure basically, percuss and measure like your liver borders, okay? I'm gonna start right here and make the liver here. Let me mark it on you again. And now I'm just gonna percuss your spleen area over here, okay? Alright. What I would like you to do, is when you sit up, I'd like you to try and use your abdominal muscles so I can see if you have any hernias or anything like that. Bulging out. Yep. Okay. I'll put this in. What I want to do is I want to inspect your arms, okay? I'll look basically for your muscle mass, make sure that it's the skin, everything's equal and there's no rashes or anything. Okay, I'm gonna go ahead and get your radial and your brachial pulses here. Okay, I'm gonna palpate underneath here. I'm gonna your ticklish, your lymph nodes, any masses or lumps or any tenderness underneath there. Just ticklish. Okay. All right. Your brachial pulse and your radial pulse. Okay. Again, I want to palpate underneath here and your no tender areas other than ticklish. Okay. All right. Okay. All right. Alright, no full range of motion with the arms, no limitations or anything. Okay, I want to make sure I don't have any lymph nodes down here, enlargement. Okay. Alright, we'll go ahead, we already did your shoulders, so that's fine. What I'd like you to do is just like move your arms, and I'd like you to have you actually move your neck, because I need to assess that. Okay, down, and to side, and back, okay. No pain or any limitations on that? Okay, good. All right, I'm gonna go ahead and look at your leg, and pull this up if that's okay. Basically, just like feel for the temperature of them. Okay, let's check for edema. Doesn't seem to be any. I'm just gonna kind of bend this leg here and pull this up. Alright, so check for the pulses back here. Check your pulse here. Good. On top of your foot. Check this pulse here. And the top of your foot. Okay, I'm gonna have you pull your knee in. Bring this in, bend this out. Does that hurt at all? Your hip at all? No? Okay. Let's try to get it right there. That didn't hurt anything? Okay. Alright. I'm gonna do some reflexes, okay? Check your arms first. Okay. Relax your arm, okay? Try again. Okay, right here. We'll give it. Okay. Just relax your arm. Okay, good. There you go. Okay, on your heels, your knees. Again. Alright, I'm going to do your Achilles tendon back here. Just relax. Go right above your heel. I hit my thumb. There we go. Okay. Alright, go ahead and kind of push your leg up. Your leg up. Okay, and push against me. Okay, good. Alright. I'd like to have you go ahead and put your band back on here. And I'll have you stand up. Okay, so just stand there and close your eyes and there we go. Okay. Okay, I'd like you to just keep standing there, and then I want you to close your eyes and take your finger and go to your nose 2 times, then the other hand, do the same thing with your eyes closed. Okay, can you walk back and forth here for me? See how you move your feet. Okay, can you walk on your heels like that? Can you walk on back on the balls of your feet on top? There you go, off your heels. Okay, and can you take your leg and with your just kind of brush down with your heel. No, down. Up, down. There you go. Try. No, there you go. Okay. ahead and sit back up there. Okay, I think as far as your physical examination goes, I said, with your physical, there's no restrictions that I can see as far as lifting, bending, standing, walking in that fashion. With your eyes, it looks like you have like a acute allergic conjunctivitis, and we're going to give you antibiotic drops that you put in your eyes 4 to 6 times a day for the next 7 days, okay? And that should clear that up. As far as your thyroid, we're going to draw some blood, all right? And then we're going to draw a T4 and a TSH, and that'll actually do you have your thyroid level. And then if the thyroid level is normal, we're going to call you and tell you just pick up your regular prescription at the pharmacy. If your thyroid level is altered, too high or too low, then we'll adjust your medication at that time, and then we'll call you also and let you know that your medicine has been adjusted. But you will have to come in about 2.5 months so we can redraw you again and see if that level has balanced out where it needs to be, okay? Also, what I like to do, I notice in your vital signs, your BMI, your body mass index, is 30. It's a little over 30 actually. So that is a little bit higher than what we want. We want it below 30, okay? Which means with it being high, it has you at risk for cardiovascular disease, stroke, and those things. So what we'd like to do is set you up with a referral to the nutritionist, okay, and go over maybe some of your favorite foods that you like, and maybe on how to prepare them with less fat, and also how to choose different types of foods, and maybe some diet plans that would be suitable to your taste and your liking, okay. Also would like to see that you would maybe pick up your walking. You walk, you said, about twice a week, maybe about 1 mile or 2. If you could do that maybe 3 or 4 times a week, then that would also help decrease your weight, okay? So I'd like to work with you on that, and that would decrease your risk factors. But with that blood that we're going to draw for your thyroid, I would like to, if it's all right with you, draw an LDL, which is your bad cholesterol, and or your HDL, which is good cholesterol, and your total cholesterol, triglycerides, to see where you're at, and to see maybe where your risk factors would be, and how high, and if they are altered or if they're just fine, okay? And then we can put a better game plan together to make sure that you can decrease and hopefully take away those risk factors with decreasing your weight and increasing your activity, okay? All right, do you have any questions? No? Okay, all right, so that's the end of our exam.